Really do. And let's talk about teeth. The importance of keeping our teeth clean. And we've got Dr. Ken Randall joining us with Tennessee River Dental. And you always bring your big mouth with you.
Bring my big mouth with me, that's right.
This is a big mouth right here. All right, let's talk about sealants, the importance of sealants. Tell us exactly what a sealant is.
Sure,
exactly.
So a sealant is basically a covering that we frequently will put over the chewing surfaces of back teeth in particular.
Okay.
It's a preventive way of helping keep us from getting cavities on those teeth in there.
Now, who qualifies for the sealant? I'm taking it young people do,
Sure.
or younger people,
So
really young.
Anybody really. It's
Okay.
preventive whether you're 6 years old or whether you're 106 years old.
Really?
It can still be preventive. Oftentimes with various insurance plans and that kind of thing, sometimes there are some details there that we have to work through.
Okay.
But they are still as preventive for us when we're young as when we get to be older in there.
How early do you put these on children?
Yeah.
This sealant.
So the most frequent use for them is anytime we see permanent back teeth in there.
Okay.
So we tend to get our first permanent back tooth around age 6 or 7 on average.
Okay.
Once the chewing surface of that tooth is all the way through the gum tissue in there, that's a good time to start putting sealants on those back teeth.
All right, Dr. Randall, you brought what looks like a needle. That's not a needle though, right?
So, no, this isn't a needle. You know, we work in really small spaces
Sure.
in the mouth, and so basically it's just a little cannula that lets us deliver the sealant material exactly where we need to in those little itty bitty grooves.
Sure. Okay. Okay. And this is how it's applied.
Yeah.
It's like glue, kind of like, right?
Yeah, so we, if it was on our tooth, we'd put a little tooth conditioner on there first to kind of help the material stick.
Okay.
And then this is basically a fingernail polish, if you will, in a sense. And it just goes right over top of the tooth in those little nooks and crannies.
Okay. You want to demonstrate this on, speaking of fingernails on my
Sure,
finger?
yeah, we'll paint your fingernails with it, so.
I've got girls at home, so I'm used to this.
Gonna make you cute today.
Now it's pink.
So yeah, it starts out pink in there, and what it does is it allows your dentist or hygienist to see exactly where the material is. It stands out in contrast to the tooth, so you can make sure you get it into all the right spots. And then what we do is we have a little blue light there that we just shine right over top of it, just like that, and then it turns white, tooth colored in there.
Look at that. So it's pink, now it's white.
Yeah. And
Can I touch it?
Absolutely. Yeah, it's hard now. You're in good shape.
It sure is. Good gracious, that dried up that quickly.
Yeah, it's a neat material, and it's a great, easy way to take care of the prevention end of things, keep people from getting cavities where you have more invasive things that are required to treat the bacteria part of the cavities.
My wife watches every day, and she's watching going, can you put that on my fingernails? Because I take it that's going to stay a long time. So let's say we're 55 years old, and obviously we have our teeth, and we want the sealant.
Sure.
Do we request it, or do you recommend it, or for everybody?
Yeah, so it's particularly in people that are at higher risk of cavities that don't have any other restorations, any other fillings or anything like that in their teeth. That tends to be a good preventive answer for them in there. People that we get that far out that are either low cavity risk or have fillings before, it won't necessarily help in those situations as much. So it's a case-by-case thing in there. Generally with children, that's where we see the most frequent cavities in there.
Sure.
And so it's pretty much a universal recommendation for children in there. It actually will decrease our cavity risk by about 80% putting sealants on those back teeth.
I was going to ask you, so if we start our children with a sealant at an early age when they get their molars in, there's a good chance they'll never have cavities? Is that safe to say?
It's one of the factors that goes into it. Certainly what we eat plays a role in there, and then keeping things clean plays a role as well. One of the neat things about sealants, it'll cover those chewing surfaces, and those little nooks and crannies in there are areas that sometimes are smaller than a bristle of a toothbrush. And so bacteria can get in there and have their little cavity party and start growing cavities in there. What sealants don't do is address the outside, the inside, or the in-between areas.
Alrighty, some good information. Thank you very much.
Thanks for
Always a
having me.
pleasure when you're on the show.
Pleasure.
Tennessee River Dental, 4845 Hixson Pike, Suite C in Hixson, Tennessee. Call if you have any questions, especially about the sealant. 423-877-3848, TennesseeRiverDental.com.